The gluteal muscle originates from the iliac bone and sacrum, and its secondary attachment is on the femur. This muscle is one of the primary stabilizers of the pelvis and plays a major role in walking. The main problem associated with this muscle is the loss of proper stabilization at the sacroiliac joint. This joint is the articulation between the sacrum and the ilium. The primary muscle responsible for stabilizing this joint is the gluteal muscle. In other words, one of its functions is the stabilization of the sacroiliac joint. This function is based on its origin and insertion. It originates from the iliac bone and the sacrum. This is its starting point, and it attaches to the rough surface of the femur. What a powerful muscle! It has two parts. One part, which attaches to the iliac bone, functions to pull the leg backward. This is what we covered in the video about the lumbar muscle. This part acts as the antagonist to the lumbar muscle. It contracts when the leg moves backward during a step. And this part's function is to stabilize the sacroiliac joint. If it ceases to function properly, the joint begins to wobble. Normally, the joint should move within a specific angle. That is, only movements within that range should occur at the sacroiliac joint. If it becomes unstable, it gains more freedom of movement than it should. In such cases, pain arises primarily in the ligaments surrounding the joint. When the gluteal muscle is weak, other muscles try to compensate for its deficiency. Most notably, the piriformis muscle attempts to stabilize the joint. The piriformis muscle originates from the inner surface of the sacrum. That is, it begins from the interior of the sacrum and extends outward. It also attaches to the femur, originating from the inner half of the sacrum and inserting into the femur. It attaches to the sacrum, as seen from a rear view, and extends to the greater trochanter of the femur. In other words, this muscle has attachments at both the sacrum and the femur, and it also contributes to stabilizing the sacroiliac joint. This is the first muscle that attempts to stabilize the joint. It does so when the gluteal muscle is not functioning properly. But what happens then? The issue is that the sciatic nerve runs beneath this muscle, and when the gluteal muscle is weak and this muscle compensates, the sciatic nerve becomes compressed. Right here, the nerve passes under the piriformis muscle. When the piriformis muscle is overstrained, it enlarges and compresses the sciatic nerve. Everything depends on the degree of compression. Initially, this may manifest as muscle weakness in the area supplied by the nerve. Later, piriformis syndrome can develop, with pain radiating down the leg. Numbness is also possible. The next muscle that compensates for a weak gluteal muscle is the spinal extensor, erector spinae. This muscle runs along the vertebrae, attaching to the sacrum at one end and to the lumbar region at the other, and it also helps stabilize the sacroiliac joint. Therefore, When the large gluteal muscle is weak, hypertrophy of these paravertebral muscles, the spinal extensors, often occurs. You may notice that the muscles on one side are larger than on the other. Typically, the affected muscle becomes enlarged, specifically on the side where the gluteal muscle is weak. In summary, the piriformis muscle and the spinal extensors try to compensate for a weak gluteal muscle by stabilizing the sacroiliac joint. If the piriformis muscle overcompensates by shortening and taking on the role of the gluteal muscle, it may compress the sciatic nerve. This compression can result in reduced thigh mobility, altered pelvic positioning, and direct compression of the sciatic nerve. When the spinal extensors are overworked to support the sacroiliac joint, mobility in the lumbar spine becomes limited. This often leads to constant stiffness or fixation in the lumbar region. The gluteal muscle also plays a role in movement during walking by propelling the leg forward. Ideally, the gluteal muscle should bear most of the load during a step. If this does not occur, other muscles, such as the hip muscles, thigh flexors, and even the quadriceps of the thigh, compensate. The quadriceps have fibers oriented in several directions. Vertical fibers run from the 12th rib to the iliac bone. Additionally, there are fibers running at an angle, from the transverse processes to the iliac bone and from the transverse processes to the 12th rib. Thus, this muscle has three distinct fiber orientations. This multi-directional arrangement enables it to contribute to various movements simultaneously, including flexion, extension, lateral bending, and trunk rotation. It also acts as an antagonist to the abdominal oblique muscles, both external and internal, due to the different fiber orientations. When the gluteal muscles are weak, the quadriceps also attempt to compensate during walking. In such cases, the quadriceps may become shortened. This results in an asymmetrical pelvic tilt, a lowering of the 12th rib, and associated pain. This may result in pain due to the formation of fixations between the lumbar joints. Additionally, nerve root compression can occur. This is caused by changes in the positioning of the vertebrae and narrowing of the intervertebral foramina due to the shortening of the lumbar muscles, leading to nerve root compression.